voltaïque, d'un régulateur de charge, d'une batterie, d'un onduleur et des appareils.
De manière générale, le potentiel du Cameroun en énergie renouvelable est important. C'est déjà le solaire avec une possibilité de 2327 TWh par jour. Ensuite, la petite hydraulique pour un brut estimé à 294 TWh l'année. Seulement 11% de ce potentiel est en cours de valorisation. L'énergie éolienne, avec une vitesse de vent importante mesurée sur les hautes terres, attend son implémentation par une centrale de 42 MW à Bambotos, financement attendu. Il va rester la biomasse dont le potentiel tient d'une importante superficie forestière, 46,3% du pays. Et enfin, des sites potentiels d'énergie géothermique révélés le long de la ligne volcanique du Cameroun. Le pays projette 25% d'énergie renouvelable dans son mix énergétique à l'horizon 2035.
Dans la suite de ce journal, Esther, les questions d'alphabétisation.
The government of Cameroon is poised to reducing the rate of adult illiteracy, which currently stands at 35%, with the majority being women. In the course of a seminar on the harmonization of research in Cameroon, the Minister of Basic Education, Yusuf Adija Alim, underscored the need to step up the quality of education in primary and secondary schools. Jamila Kadzalat has the details.
Adult illiteracy continues to be a major problem in Cameroon. Statistics from the Ministry of Basic Education indicate that 35% of adults and 8% of children aged between 6 and 14 are on school. It is to address this situation that a workshop on the drafting of literacy programs by the UNESCO Institute for Lifelong Learning opened in Yaoundé.
Rama Project is an initiative which puts together 12 African countries, which aims at improving literacy in those countries. That is to measure and evaluate learning outcomes of beneficiaries which are registered in literacy centers.
Participants are expected to propose strategies that will strengthen the capacities of women and children in the domain of literacy.
We improve not only the population literacy level, but we improve also the productive capacity in a way that not only they learn how to read and write, but they acquire know-how on how to implement, how to improve upon their technical and professional capacities on the field.
According to Minister Yusuf Adija Alim, this year's education agenda will be renewed with efforts to improve quality education in the formal and informal sectors.
Health practitioners charged with the treatment, care and follow-up of HIV-infected persons are updating their skills on the management of drug resistance in Cameroon. This is at a two-day workshop dubbed Treat and Test, organized by the Chantal Biya International Research Center. The strategy is aimed at screening and providing immediate treatments to HIV-infected persons before the viral load becomes uncontrollable. Staff Lady Igdanga Kebi followed the deliberations and now reports.
According to statistics, the purpose of the Test and Treat workshop is to attain the 1990 results, that is, 90% of infected persons should know their status, 90% of seropositive persons should be on treatment, and 90% of treated persons should experience a reasonable suppression of the viral load in their bloodstream. So far, drug resistance remains a major problem in Cameroon.
In order to keep the virus under control, in the future we have to treat for the first line, probably treat for the second, and perhaps treat for third and fourth line.
With the new strategy, the biologists, clinicians, doctors and other stakeholders participating in the capacity building workshop will successfully learn more on the following: the control of drug resistance, sustaining a successful lifelong antiretroviral treatment, potential treatment response, just to name a few.
Thanks to the training that we have from the University of Vomto Vegata, which is our main partner in the field of virology, we have been able to develop skill to perform laboratory analysis for drug resistance and also to be able to initiate the interpretation of drug resistance mutation.
It is difficult for us now to handle cases of patients who are resistant to antiretrovirals. We still continue to motivate them, to let them live healthily with diet, improve on their lifestyle.
Created in 2006, the Chantal Biya International Research Center is forging on well in the quest for a pediatrics vaccine that will help reduce the spread of the transmission of the HIV/AIDS virus from mother to child.
From the test and treat strategy on HIV/AIDS to diplomacy, the French ambassador to Cameroon, His Excellency Gilles Thibault, ends a 2-day working visit to the Northwest region with the inauguration of an edifice at the Bingo Baptist Hospital, partly funded by the French Development Project. Prior to the inauguration, the diplomat paid a courtesy visit to Alliance Française Bamenda, the Bafut Palace and the Eco Village, as well as the potato production unit in Bambui. Dixon Ashun reports.
In traditional rhythms and dance display, the staff, patients and population of Bingo welcomed the French ambassador. A guided tour around the hospital facility enabled the diplomat to make first-hand appreciation of what the over 65-year-old structure has in stock for its patients. Reputed for expertise in handling cases of fracture, cancer and other complicated health situations, the Bingo Baptist Hospital had quickly run short of accommodation facilities. With assistance from the French Development Project, the hospital now has an additional structure that will accommodate the extra patient population, today inaugurated by the French ambassador.
We have a place where we can receive patients that have emergency needs, like those that are coming in very critical condition. We can receive them here, take care of them, then we send to the intensive care unit.
Gilles Thibault before then had paid a courtesy visit to the Bafut Palace, where he met one-on-one with the history and culture